If you've got lower back sensitivity, if you've got back pain, if back pain is limiting you from doing your hard training, loving workouts, this video is for you. Now, just a disclaimer, I'm not a doctor. I am an experienced, certified, tenured coach, over 15 years of training experience, and I've dealt with a lot of back problems. Rule of thumb, first rule, get a diagnosis. You have to see a doctor. Don't see a fitness coach, don't see a trainer. You have to get a diagnosis. Even though a lot of experienced trainers know what they're talking about, you gotta see a doctor, okay? Get a diagnosis. Rule number 2, always do what doesn't hurt you. Always do what doesn't cause pain. Always do that doesn't make your lower back problem worse than what it is. So for example, right? If someone is giving you advice on to do a plank to strengthen your core, that would mean that you would do this plank like this. Right? Now, just to educate you, a plank can be a very tough exercise and can be a detriment to your lower back pain or pre-existing lower back pain, or it can be a helper. That is up to you, and then you would determine whether a plank is a keeper for you or not. And how you determine that is you ask yourself, does the plank actually hurt my lower back? If the answer is yes, then you find something called a modification. So here's a modification, a plank on my knees and my elbows to engage and concentrate on my abs. Ready? Watch this. See, now I'm doing a plank modified. See, knees, and I'm really engaging my abs, and really working on my abdominals. See? This is called a modification, right? If and when you get strong enough, you can do this. The other thing is, can you or should you do sit-ups or crunches? Once again, what's rule number 2? Do what doesn't hurt you. So, if this hurts you, which I would advise you against doing a lot of sit-ups if you've got back problems, then I would only do this. Just nice crunches, controlling. That's it. Or you want to do this, right? But this might hurt you if you're hyperextending your lumbar. If you have a tendency to do this, it might hurt you. That's why I do this and make sure that I have a little bit more support and I'm flattened out a little bit in my spine. You can see it's flattened out. See? Really working the muscle, making the neck safe and secure. Right? Third, my favorite. If you've got back issues, the most important thing for you to do is actually train your glutes. You see, most lower back issues stem from a lack of strength and stem from a lack of glute muscle mass or glute strengthening. So the idea is to strengthen your glutes. And chances are, if you're a normal person that has a normal desk job, you're probably not working your glute muscles. You probably don't have enough muscle mass in your booty. So watch this. Up, nice and easy. Don't let the butt touch. Up, slow. Real focused. Neutral. See? Okay? None of this. None of this. Okay? The more controlled you are in your motion, the better you'll be able to assess what helps you or what hurts you. So, to recap, rule number 1, get a diagnosis, get an assessment from a doctor, figure out what the issue is. Rule number 2, do what helps you and does not hurt you. Only you can determine that. And number 3, always get advice from people that are either fitness professionals, certified, trained, and experienced in the problem you're having, or medical professionals. Good luck.